Can we be more accurate with our diagnosis than non-specific low back pain? This systematic review from Hahn et al. In 2023 challenges how we diagnose persistent low back pain. And they looked at 60 studies, and what they find? Well, for disc pain diagnosis, if you get centralization with repeated movements, you've got a likelihood ratio of 3. So that means you're 3 times more likely to have discogenic low back pain. Also, if you've got an MRI that shows motor changes, type 1 or your type 2, that's your strongest predictor. You're 10 and 8 times more likely to have discogenic related pain. What about the SIJ? Well, if you had no centralization with the previous repeated movements, you've got no midline pain, then you can look at a cluster of tests, not your individual tests, but maybe your Gainslands, your thigh thrusts. If you get 3 or more of those SIJ tests that are positive, then you're looking at SIJ pain. And the facet joint? Well, unfortunately, our clinical tests can't diagnose facet joint pain. SPECT imaging is the only thing that can actually give us some information. So that's the study, and there's a couple of questions that raises. Does the diagnosis actually change your treatment? And then if we get a diagnosis, should we actually tell our patient, oh, you have discogenic low back pain, or is it nocivic? Let me know in the comments below, and tomorrow I'm going to explore a new RCT on discogenic pain. So join me then.